With much left to learn about coronavirus, doctors are now zeroing in on post-vaccine safety. A CDC advisory committee says it's now studying myocarditis in younger patients.
The symptoms of myocarditis are going to depend on the severity. They could range from shortness of breath to chest pain, and sometimes when it's more severe, people may have swelling of their legs.
It's uncertain how many vaccinated patients have been affected, but according to the research group, most cases appear to be mild and are predominantly seen in adolescents and young adults. The condition typically emerging about 4 days after the second dose of an mRNA vaccine, and it's happening more often in males. During the pandemic, myocarditis was being reported in patients who had tested positive for COVID-19.
For patients who have been diagnosed with coronavirus, we think that the incidence of development of heart problems might be as high as 30%.
In April, the Department of Defense said it was looking into 14 cases of possible myocarditis in people who were vaccinated by the military. In a White House COVID briefing, CDC Director Dr. Rochelle Walensky, quick to say, causation has yet to be found.
We have not seen the signal, and we've actually looked intentionally for the signal in the over 200 million doses we've given.
Experts like Johns Hopkins senior scholar Dr. Amesh Adalja says it's still best to get the vaccine.
These cases are very rare and very mild. And when you look at the overall benefit of the vaccine, the benefit outweighs this risk of myocarditis, even if it's established as a risk.
Now, earlier this month, the FDA greenlit the Pfizer vaccine for children as young as 12. And to date, about 4.6 million Americans between the ages of 12 and 18 have received at least their first dose of the shot. And CDC advisors say all these reports, these few reports of younger patients coming forward, does not differ from expected baseline rates. Morning.